how can you help your friend or family who's actively having a panic attack? I'm ER Dr. Larry Burchett, MD, and in my career, I've been with hundreds of patients who have had panic attacks. In a moment, I'm going to walk you through a sequence of things you can do when somebody's actively having a panic attack. But first, I want to just review 3 things before we do that. Number 1 is we got to make sure that this is the right diagnosis and that their symptoms, which are often chest pain, shortness of breath, tingling, are not something serious. If somebody has been diagnosed with a panic attack and they've had many of them in the past and we're sure that's what it is, great. If there's any question, then you need to go to a doctor and make sure that you've got the right diagnosis. So I would not recommend this unless we're sure that this is a panic attack. The second thing I want you to know in that same reasoning of when to go to the ER is we can try this stuff at home, but if it doesn't work, the ER is always there with more powerful tranquilizer and sedative medications that sometimes, even if we do everything right, we need medication to break somebody and free them of the panic attack. So keep that in mind too. The ER is always there for you if you need it. Now, the second thing that I want to say is you need to stay calm. If somebody's having a panic attack and you freak out and you're like, oh my God, you're having a panic attack, that's not going to help them to calm down and feel better. It's only going to make it worse. Now, the reason that you can be calm is that panic attacks, by definition, are temporary. They're not permanent, they don't last forever, and they don't result in permanent damage, as opposed to a stroke where somebody can end up in a wheelchair. So know that a panic attack, somebody is going to feel better. It is going to go away. And that can give you the confidence to approach this calmly, because you're going to mirror to them. Your own staying calm is going to help them to calm down. The third thing I want you to know is that panic attacks are random. They're often not precipitous. Well, patients tell me there can be underlying stress. There certainly can be prior trauma, all this kind of stuff. There are triggers. But panic attacks, most of the time in my experience, they're totally random. They come on for no reason. And this is where I want you to have some compassion. They're not somebody's fault. They're not something they can control directly. So have some compassion for your friend or family who is going through this, because they often feel like these panic attacks, like they're victims of these panic attacks because they just come on in the middle of nowhere. There certainly are things you can do, from certain therapies, cognitive behavior, and medication, and exploring prior traumas and all of that can help somebody and to prevent and manage it. But in the moment, these things are not something people can directly control. And so I would encourage you to have some compassion for this friend or family, because they often feel like in that moment that they're truly dying, like something is severely wrong and they have chest pain that's going to kill them in a heart attack, or their numbness is a stroke and that their life is threatened. So have some compassion. Okay, so if you come upon somebody, your friend, family, again, we know that this is what it is. What can we do for a panic attack? Okay, so the first thing that I would recommend is that you come up to them and you don't face them head on, but kind of maybe a 45-degree angle, put your hand on their shoulder, start speaking to them in a very calm, controlled voice. Not like this, oh my God, panic attack. But you put your arm on the shoulder, try to make eye contact if you can, and you say, this is gonna be okay. You're gonna be okay. You've had these before. I know that it feels really bad and you're really worried, and they've gone away. And we know that's gonna happen again. Again, kind of the repetitive, the calming. See what I'm doing with the voice? That's just as important as what you're saying, is the way that you say it. So I put my hand on their shoulder, look directly in their eyes, and say these things. You know you've gotten through this before. You're going to get through this time. It's gone away before. This is going to go away. Step 2 is, as you started to talk to them and they start to listen to you, I would make sure that they're in a comfortable position. Most people like to be seated or on the ground, not standing. They can be a little, and most people aren't at risk of not going to have a seizure or pass out. Maybe some people might hyperventilate, breathe through and pass out. So you might want to encourage them to sit down, but whatever's comfortable. If they feel more comfortable standing, walking around, fine. But I would encourage somebody, oh, so you're going to be okay. We're going to get through this. Why don't you sit down? Come, let's sit down over here. So they sit down. So step 3 is, again, still hand on the shoulder. Say, focus on your breath. We can't control these symptoms, but we can control your breathing, and focus on deep breathing. Seconds in, pause, and coach them through breathing for like 5 or 10 breaths. Take a deep breath, control your breathing. You can control your breathing. And the reason that I like the breathing very much is that in panic attack, there is so much adrenaline and cortisol in the system. There's just so much adrenaline. People are stimulated. It's fight or flight. That's part of what is driving all of these symptoms of shortness of breath, chest pain, numbness, all this stuff is being driven by adrenaline. So the treatment is to get the adrenaline out of the system. And a great way to do that is by deep, controlled breathing. The faster you breathe, you can do this right now, right? You breathe fast and you can feel your body hypes up, your adrenaline goes up a little bit. As opposed to, you take slow, deep breaths, hold for a second or two, and you can feel that adrenaline start coming out of your system. So I will coach people through 5 or 10 of these deep breaths, hold, and I'll do these motions, these almost kind of yoga, flow, whatever motions to help people get into it. Again, I think it's appropriate to touch somebody on the shoulder, connect with them, give them this reassuring presence that they are going to be okay. So as you get into some breathing, people are still going to have symptoms. Remember, stay cool. It often takes 10, 20, 30 minutes to get through this. So don't think it's going to snap, go away in a minute or two, because usually it doesn't. But you can start to slowly get that adrenaline out of the system. Again, number one, we did this, 2, the breathing, and then number 3, I like to distract a little bit. So I started with clenching the fists and timing this with breathing. So once you do 5 to 10, once you get somebody in a rhythm of the breathing, then change to this and focus to this. So you go deep breath, and then I want you to squeeze as you're pulling in, and when you exhale, release and let all that tension out through your hands. In, pull it in, get as tense as you can, and let it go. Do 5 or 10 of those. And then add one more thing, again, to continue to try to distract this mind and let their whole body relax. Let's go to the feet. As you inhale, tense and pull your feet up, and then exhale, push down like you're pushing on the gas. Same thing. And then we're doing hands and feet at the same time. So you clench your hands, pull your feet back, inhale, exhale, let go. Get them into a rhythm of this, and it helps people feel like they are in control of something, and to put their focus less on the symptoms they're having and more on concentrating on their breathing and on, contraction and relaxation that can help the body to relax a little bit. And then I would cycle back through these things and see how somebody does. You'll see that their breathing will start to slow down. They'll look a little bit better. They may still be feeling high anxiety. Again, it may take 20, 30 minutes for this to kind of go down and get out of the system. Again, at any time, if somebody has too intense of symptoms or anxiety, they're not willing to sit still, go to the ER. Like, that is what it's for. But this is how you can kind of talk somebody through it and do your best to be there. And then at the end of the day, just make sure that they know you're going to be there. They're going to be okay. And you're going to see them through it. That can be very comforting as well. But remember, the ER is there for a reason. There's some panic attacks that are not going to break with this. So you need to go to the ER. If somebody has a sedative tranquilizer medication like Ativan or Xanax, and they commonly take 1 milligram of Ativan or 0.5 milligram of Xanax, and that's available, and they use it, and it's safe, and they haven't been drinking, or there isn't any other drugs on board or reason to not take it, that can be appropriate. But I'm not going to tell you to do that over this video. That needs to be guided by their physician. But that can be an option to help them to break it as well. I hope this has been helpful. Again, it's very important for you to be calm, no shame, have compassion, because these people feel really, truly like they're dying and are trapped in this moment. But you can help be a calming presence. And these are just some of the things that I do to help get people through that. I hope this was a helpful video. Please respond to this. Reach out to me at Dr. Larry Burchett on social media. As always, stay safe, stay sane, do your part, and I'll see you next time.